orthopedic evaluation class. This is my patient evaluation reflection number 2 over an upper extremity injury. After this injury occurred and after I had done the evaluation, I had a long talk with my preceptor, Alex Van Dusen, at South Vermillion High School about what I did right, what I did wrong, and what I could have done better. Overall, he was actually really impressed with my evaluation skills. He said that I had done really well, and it's probably one of my better evaluations I had done. Although he did say there were a couple things I missed, like I could have done a couple more special tests, is what he said, as well as I could have used the goniometer, since I now know where it is. ATTR. He said my palpations were really good. He said that my manual muscle testing was spot on. There was only one manual muscle test that I missed that he thought I could have tried, which was the serratus anterior, but he said it wasn't as big of a deal because I did get the right diagnosis. I was spot on with my manual muscle testing and my range of motion testing as well. There was another thing with range of motion testing. He said I could have done passive, just to make sure there's no bony block or there's no deficit with passive at all, as well as I could have done internal and external rotation at the arm just to see how those muscles are working, because I didn't really test that with range of motion. He said I just kind of did the manual muscle test for those, and for spinatus and teres minor I did those, and so I got the gist of internal and external rotation from those, and then the subscap. But he said I just didn't use range of motion testing for that at all. But overall, he said I had done really well, and he was very impressed with my observations as well as my palpations and manual muscle tests. He said I had done a very thorough history, which was probably one of my best. I was really proud of myself. And he said that if I had an upper extremity SIP, then he would have probably signed off on it. Overall, my clinical decision making for this evaluation, I kind of went through, I decided I was just going to follow exactly along with the SOAP note, take my history, observe what I can, range of motion, manual muscle tests. Special tests, I only done really one, if that, and it wasn't very informative. But I'd start off with a very thorough history. I made sure I kind of went in order, piggybacked off of each question that I asked and each answer he had given me. I would do correct pauses so that he could fill up the space with extra information if he wanted or needed. I felt like my history is probably my best part. I mean, we've been practicing in class a lot. So my clinical decision making there, I was just kind of thinking, rule out what I could. So I wanted to make sure, did you have pop? Because if there was a pop or something like that, the possibility it might be a labrum or even a strain at that point. I just kind of went through, asked my question, make sure there's no numbness, tingling, because it could be an impingement of some sort. I asked, if the pain had subsided at all, what kind of treatment he had done, so I could know what I'm working with and what to do and what not to do to help improve that. Because if he had been icing and heating and resting it and nothing had been helping at all, then what's the point? And I asked what his doctor had said, because that could have a big impact on how I diagnose it. Because, the patient said they had manual muscle test, or they had a manual, I can't even talk. They had a muscle spasm, as the doctor had diagnosed it. And so I was checking all the muscles around structures, make sure there was nothing wrong with the structures either that could have caused the muscles to spasm. I know I had, after my observation, there was a pretty nice bump on the scapula, and so I figured possible bursitis. It wasn't a strain, it wasn't a tear, complete tear or anything like that, because his muscles all around the structure worked fine. I was thinking just possible bursitis or pop bursa. It could have been causing some issues as well, some inflammation in the area. I made sure that, there was nothing serious with the injury. That was my number one priority, was making sure there's nothing very serious with it, as in like a fracture, a labral tear. I was just mostly making sure there was nothing that he needed to go back to the doctor for and get x-rays or anything like that. I mostly wanted to make sure that he could continue going on throughout the week and like even still continue running and just doing some more treatment as well as some strengthening exercises. But yeah, overall my main priority was just to rule out serious injury and make sure it was something that we could work with easily and subside. For my range of motion, I was mostly just making sure that he could still move his arms up and down, flexion, extension, abduction. Make sure he was able to do all of that. He had some pain, he had some limitations, but it wasn't very noticeable compared to his other arm, his left arm. So I wasn't too concerned because I feel like if it was something serious, then it would be significantly limited. And he could still move his arm so he could reach for things if he needed it. He wasn't in a terrible amount of pain. There was no point in time in which his pain had jumped from a 4 to like an 8 or anything like that. I mostly wanted to make sure that posture had anything to do with it as well, so I was very observant. I wanted to make sure, it was the pain causing him to slump forward because pulling his shoulders back kind of hurt him. So I was just making sure of what motions were causing pain, what wasn't, because I wanted to be able to help with him and work with him on getting back those motions. That was my main priority in my clinical decision making. And manual muscle testing, I just went through any muscles that I felt like were involved with the area of pain that he was describing, because I wanted to know what muscles it was the doctor described as being in spasm. And special tests, I think after I did the manual muscle testing and all my history questions, I didn't really feel a need for very many special tests because I was 100% positive it wasn't a labral tear, just because it was at that inferior angle of the scapula. It was nowhere up in here. There's no pain up there at all. And so I just kind of slowly ruled out things, mostly based on location and history questions. Couldn't have been an impingement. There was no clavicle injury. The only thing I could really think of was possible fracture of the tip of the scapula, bursitis, and muscle spasms. Just because of the location, it would have been hard for much of anything else to have happened. And so I just kind of worked things down until I realized I really didn't have a need to do any special tests. I could have done a couple special tests just to make sure I had everything ruled out correctly, but I didn't. And that was just my clinical way of thinking. I figure most athletic trainers would feel the same. If they didn't feel the need to perform something, they wouldn't. There's no point in going through all the special tests if you're 100% positive it wasn't something. And then I just mostly came to my conclusion that it was a muscle spasm, just because he wasn't necessarily tender on the tip of the scapula, more around it where the muscles attached. So I was just concerned more about the musculature. But overall, that was my clinical decision making. And my action plan for improvement, it's going to be the same thing every single time. I'm just going to work harder at what it was I missed. I know I didn't use a goniometer. My number one action plan for that is to practice more in clinicals. I intend to go over the ranges of motion more. I'm going to go through my kinesiology book and look at the ranges of motion, because I feel like that should be important, especially if I'm going to start using the goniometer. It'd be good to know the normal ranges of motion, especially if somebody has injured both, say, ankles. Then they don't really have a normal range of motion. And so I'm going to have to go off the normal ranges, which had been given to me here at school. My action plan is just to practice using goniometer more, look up the ranges of motion, utilize my time more in class and practicing with the goniometer, and then hopefully being able to apply that in clinicals. I'm going to try to remind myself every time I'm doing a evaluation to, alright, we're going to get out the goniometer first, just so I have it in my hand, because if I have it in my hand while I'm going through an evaluation, I'm more likely to remember to use range of motion, like with a goniometer. And then I'm hoping that after they perform actively, I'm going to remember to do passively. I'm trying to get down a routine so that I go active, passive, resistive, like, just try to, like, use it when I can, I guess. Yeah. So I'm thinking just kind of go through all the ranges and try to set up more of an organization for my plan in my evaluations, is have it organized better, just so that I can touch on all of the range of motions, active, passive, resistive, while using a goniometer, so that I can get used to doing that, because especially if I want to do PT school or anything like that, you definitely have to have those normal values that you get from your evaluations down so that you can get reimbursement and all that fun stuff. My next action plan for improvement, I definitely think I'm improving on my manual muscle testing. I'm starting to get down a system, but it can't hurt to practice more. My plan for that is just practice more manual muscle testing and, like, getting down a routine so I'm not having the patient flip here, flip there, roll over, get up, stand, all that before I can ever actually have them go back through it again, because having them roll over several times can kind of cause them pain, or they get annoyed with flipping back and forth, like, which way do you want? And so I feel I just need to get a little bit more organized with my manual muscle testing, and so I'm going to practice getting a more organization. I might come up with a paper and put down all the manual muscle tests I can think of for the shoulder and attempt to have it more organized so that I know which one's facing up, which one's facing down, which one can they be sitting up for, which one can they be standing, and just kind of go through that and organize that depending on where the patient is as I'm evaluating them. Because if they're already sitting, then I'll go through all the sitting ones first. If they're already standing, then I'll go through the standing ones first. I think I just need to work on organization overall, and I do intend to practice on that in class with my friends, and then, like I said, with the piece of paper, writing down all of it. Lastly, my action plan is, I definitely know I need to go back through all special tests. I need to remember what special tests there are. I intend to make flashcards and special tests, and then on the back side having what they're used for and what a positive sign is. I just mostly think I need to practice more. A majority of what I miss is just things that I know I need more practice on. I did do everything bilaterally, so I was very proud of myself for that, because I've been practicing on that non-stop for the past several semesters. So I intend to just get more practice in and get everything to the point where it's not quite perfect, but it's enough to where I could be a professional, I guess. Because it is important that even though I am a student, I get it all about just organized as if I was the actual athletic trainer. Because if you miss something, you could become liable eventually, and sometimes it can become a habit. So definitely intend to practice more as my major action plan for improvement. I can't really think of much of anything else which is absolutely necessary. But like I said, just organizing my manual muscle testing, make sure I manual muscle test everything when I do range of motion, active, passive, resistive, using a goniometer. And then just making sure I practice it all so it becomes a routine for myself.